The question is, when do we start vaccinating without the immune system and nervous system being severely threatened? And there, science doesn't help us. We don't know anything about this. At the moment, it's a kind of intuitive decision. Can I do this to my child, and if so, when? I think that a possible compromise is starting vaccinations after the first birthday. Several reasons. The stability of the nervous system is quite... Immune system. Can I say that? I meant to say that. So it's more stable than when they're so young. The blood-brain barrier is the neurological development is further. When they start talking, when they start walking, you can see this, but I can't prove that that point is better. It also depends on the parents who may be scared about tetanus or other illnesses. You know, that they say, okay, my child can go through this. The risks that you also have to look at, vaccinating later, not the 9th week, but the first of the end year, the risks are not a lot. I will talk about tetanus later on. In the first year of the baby's life, that is not very likely. There is a maternal passive immunity. First of all, children have antibodies if the mother has been vaccinated. If she was vaccinated, the mother was vaccinated right before the pregnancy, then the children right after their first birthday have quite a high titer. Pertussis in the first year is a problem, and invasive vaccinations with high HIV and pneumococci. That's also a problem, and they are recommended in the first year. And when you talk to parents and inform them, then you have to inform them about the risk. If you tell them not, you know, that if you say that you wouldn't have your child vaccinated in the first year. 3 of the vaccinations which are at the moment recommended now have been in use for years. Tetanus, diphtheria and polio. They are 3 severe illnesses. Diphtheria up until
Und man kann sicher über Wege diskutieren von diesen Impfungen.
We can discuss all of these, each of these vaccinations. Tetanus is now rare. At the moment, the risk is 1 to 20,000, and most of the time, if you're not vaccinated, it's all okay. It's not a high risk. In Germany, in a child, I have seen the child go through tetanus. I've seen a lot of tetanus in the Peruvian Children's Hospital. It's an illness which has not vanished off the face of this earth, and there is a high mortality in the world.
Ich empfehle die Impfung aus verschiedenen Gründen. Einmal halte ich die Impfung
I recommend the vaccination for different reasons. After the first birthday, I think the vaccination is the more reduced risk. I cannot prove it because there is the story with the aluminum hydroxide in the background. But the vaccination concerning the acute side effects seems good, being tolerated well. The side effects of not being vaccinated frequently are anxious parents or anxious mothers. And that is a side effect you can't disregard. I had a mother coming into my practice with her child, age 3, saying she wants finally now to let the child be vaccinated because she wants to let it into the garden on its own to play, finally. And many parents are very much afraid of tetanus, and I can tell you with a probability of 1 to 20,000 that I cannot completely free the parents of these fears. Diphtheria and polio is absolutely gone in Germany. Diphtheria almost completely gone. In the last 10 years, we had 5 cases of diphtheria in adults. The last children's cases were in the 90s. Polio, the last case was 1992, so there is no time pressure. I think the program itself is meaningful. If we would stop the vaccination program, within a few years the diseases would be back, not as severe as they used to be because our standard of life has increased. But according to my opinion, I think more than 90% of all children should be vaccinated in order to prevent reoccurrence. With diphtheria, we need a combination vaccine for children. There is no separate singular vaccine only for diphtheria. If we look at the contents of aluminum ions in vaccines, you can save aluminum if you look for vaccines which have a low amount of aluminum.
Es ist schwierig, da an die Informationen zu kommen. Ich habe es halt zusammengetragen.
Difficult to get clear information. I tried to gather as much as I could.
Pentavac oder mit diesem TD-Revaxis ist relativ günstig jetzt im Vergleich zum Sechsfach-Impfstoff, der sehr viel Aluminium hat. Oder dieser Tetanus-Einzelimpfstoff von
Pentavac contains fairly little amount of aluminum compared to the six-fold vaccination, which contains a lot.
Es gibt derzeit keinen Impfstoff
right now, there is no vaccine against tetanus, diphtheria and polio for the first 5 years of life. Revaxis, which is still on this list, is only allowed for children age 5 or older. At the moment, there is no possibility to find a combination vaccine for infants without pertussis. There are quite good facts for pertussis. It's a very straining disease which can cause problems like meningitis or also pneumonia. In infants, within the first few months, if they contract pertussis, there is a certain mortality which many don't know. I think it's supposed to be somewhere between 0.1 and 1%. So, if you try to prevent pertussis in infants, the vaccination comes at a point which is too late. It's recommended from age 4 months on. That age already limits the dangers. In the latest, even if you start vaccinating, then you lose protection when they come to kindergarten. Plus, you have an increased risk for asthma.